Welcome everyone. It's the top of the hour. I'm Dia Wagas back in Houston, and I'd like to welcome you to today's GlomCom seminar. Our talk today is the kidney biopsy, an introduction for nephrologists, and we're excited to have our speaker, Dr. Vanesa Bijol, professor of pathology at Northwell Health in New York, and course director of the Kidney Pathology Certificate Program of GlomCon.
Thank you. I hope you can hear me well. I'm gonna share my screen. And as I'm doing that, I'm just going to say, I was asked to give this talk on basic kidney biopsy for nephrologists. So this is a talk from a renal pathologist to nephrology community. And I do see that we have some renal pathologists in the audience. So this talk is probably very basic for you, but please feel free to chime in as I go. So let me get my pointer. And this is what we will be covering today. So I really wanted to talk about the kidney biopsy from the moment we get it to how we process it and how we actually review it. And at the end, I will talk a little bit about the kidney biopsy reporting, at least the way I do it. And please take that as just my personal way of handling it. So when it comes to the specimen adequacy procedure, I really think that either a renal pathologist or a histotech that is trained for evaluation of kidney biopsy specimen should be on site every time the kidney biopsy is performed. And that will help really obtain the adequate tissue that we need for evaluation that, as all of you know, includes not only light microscopy, but also immunofluorescence and electron microscopy. So to really get to a decent kidney pathology diagnosis, you need to integrate all these studies and reports from light microscopy, immunofluorescence, electron microscopy. It all needs to make sense, and you integrate that with the history, and you can then help the nephrologist treat the patient. Without the immunofluorescence, you will be missing practically all the deposition diseases. Without the electron microscopy, you can't really evaluate GBM abnormalities like thin basal membranes, hereditary nephritis, but you will be also missing, in general, not only organized deposits, but even subtle changes like subtle endothelial cell injury and so on. So really having all these three is really important. And I always get questions from people from parts of the world where electron microscopy is not easily done, how to actually live without it, or how to cut the corners in various ways. And I think that's really a disservice to the patient care at the end of the day, because you really have to have these things. And sometimes it feels like an overkill, but very often you kind of like are grateful that you have all these studies when you can perform them. I'm not going to talk about the procedure in itself, but as you are on a site as a pathologist or histotech or pathology assistant, you should actually come equipped with various things, including stereo microscope. And I am showing here an image of a stereo microscope that I actually bought on Amazon. And you can always find, not even an expensive one, but that can serve the purpose. And I actually used to have it in my car. And when I would go to procedures off the site, I would just pull it out of my car, and you actually can see the specimen really well because you have what is called actually stereo microscope. You don't have a stage here, but you have a space where you can manipulate your specimen, and you can actually see the texture of the tissue core that you're given. Many of these, including this one, have the LED light, which is really, I prefer that over the regular old-fashioned stereo microscopes. because that light does not really burn the specimen and